Good evening, everyone, and thank you for joining us for today's webinar. My name is Janet Griffin, and I am the Director of Alumni Relations at NYU Rory Myers College of Nursing. On behalf of the NYU Myers Alumni Association, I want to thank you for joining us for another faculty lecture that showcases research taking place at the college. Tonight, we are joined by Dr. Bei Wu, who is an inaugural co-director of the Aging Incubator at New York University. She holds the position of Dean's Professor in Global Health and Director of Global Health and Aging Research at NYU Myers. She is also the Director of Research at the Hartford Institute for Geriatric Nursing at NYU. As a principal investigator, she has led a significant number of projects supported by federal agencies. Currently, she is leading an ongoing NIH-funded clinical trial to improve oral health for persons with mild dementia. She is also conducting another NIH-funded study to examine the impact of co-occurrence of diabetes and poor oral health on the incidence of Alzheimer's disease and related dementias. Dr. Wu will explore recent research on the prevalence and impact of social isolation and loneliness among older adults in the US during the COVID-19 pandemic. She will also share approaches to decrease them in this vulnerable population. If you have questions during the session, please enter them in the Q&A box on your screen. We will get to as many questions as we can at the conclusion of the program. I'm going to turn the program over to Dr. Wu.
Thank you, Janet, for the introduction. Good afternoon, everyone. I would like to thank the Alumni Relations of the NYU Myers for inviting me to give a presentation today. It is my great honor to be here with you all. Greetings from New York. So today, I would like to share my insight and my scholarship with you on the topic of isolation and loneliness among older adults during the pandemic. So we all know that older adults, no doubt, have suffered the most from this pandemic. My doctoral student helped me generate this slide for the talk. So we actually using the age group 18 to 29 age group as the comparison group. And that then show that how actually that as age increases, how this kind of the rate of hospitalization, the deaths also kind of varied. So using this comparison group, we found that the rate of COVID hospitalization and the deaths increases with age. For those age 85 or above, the hospitalization rate is 13 times higher, and the death rate is 207 times higher. So we are fully aware that racial ethnic disparities are major and persistent challenges facing the country. From this table, that we can see that in comparison to the white non-Hispanic population, all minority groups had a high rate of COVID-related hospitalization and deaths. Blacks, Hispanics, and American Indians had a much higher rate for these indicators, the hospitalization and the mortality. So that one reason, major reason that think about why older adults probably suffer the most is possibly related to kind of a relatively weaker immune system. So that related in these actually, if you look at these conditions listed from this slide, that these are underlying medical conditions that are strongly associated with increased risk for severe COVID-19 illnesses. And then most of these conditions are highly prevalent among older adults. For example, cancer, COPD, type 2 diabetes. These are actually, so that's actually one kind of major reasons to think about these, the older adults, the impact on older adults, hospitalization and the mortality. So here, this is an article, this is the table is from the article published in JAMA internal medicine spring this year. The authors looked at nursing home residents using national data. So if you look at this left kind of figure here, compared with residents aged 75 to 79 years old, the odds of death were much higher as people get older. Then you look at this right-hand side of the figure, that compared with cognitively intact residents, the odds of death among residents with moderate cognitive impairment were 2 times higher. And the odds of death among residents with severe cognitive impairment were 2.79 times higher. Then you look at the middle kind of figure, that certainly for those individuals compared to these with less functional impairment, those with a higher level of physical functioning impairment also have a high rate of mortality. So that as Janet gave you the brief intro, that I have currently have several ongoing projects related to dental care and oral health in older adults. So certainly that I would like to kind of share some of the kind of how this COVID-19 impact on dental care. So COVID-19 has greatly impacted dental care across dental care access in the US. Dentistry considered as one of the most high-risk occupations to virus infection. Based on the American Dental Association estimate that COVID-19 leads to a 37% reduction in US dental spending in 2020. And estimates suggest that a 20% reduction in dental spending in 2021. The oral health status of older adults has been impacted mainly due to their delay or avoid dental care treatment or preventative dental visits. So here, that during the peak of COVID-19 in the US, which is from February to April 2020, that this figure shows that all ambulatory healthcare organizations settings had a drop in employment rate. However, if you look at this, that the most significant actually is a dental office. Dental offices had the highest drop of the employment, which is actually close to 56% drop in employment. So my student and I currently have a systematic review under review that we looked at, conducted the study of oral health conditions in the COVID-19, the systematic review and the meta-analysis of the current evidence. That we found that 15 eligible studies from 10 countries that basically that dry mouth is the most common reported oral health conditions among COVID-19 patients. Then you look at actually 41% reported having dry mouth symptoms among COVID-19 patients, and 39% reported having oral lesion, 18% had oral facial pain, and 12% had periodontal symptoms. So we also found that periodontal disease was not associated with COVID-19 positivity or mortality, but was associated with COVID-19 severity. So that in the next part of my presentation, I will particularly focus on the topic on social isolation and the loneliness in the context of COVID-19. So that, as many of you know, that we have been working from home for the past 18 months or so, that in our daily life, that we're lucky to have a lot of kind of social interactions, that many calls with my colleagues kind of across the globe via Zoom or WebEx, and that's what we are doing right now. Also, I also have my family members living with me, but just think about that for those individuals, and particularly for those older adults that were living alone, that certainly that not able to have family members present or lacking access to the internet and the technology devices. This would make it very easy for them to feel socially isolated and lonely during this time. So spring this year, our NYU Aging Incubator organized an image competition. This picture was a part of this image competition. The picture was taken by a graduate student from Tisch School at NYU. So here in this picture is her 92-year-old grandmother. She's an artist living alone among her vast collection of treasures. So these statues and religious relics have taken on new significance as her steady companions through the period of isolation. So here, just that I would like to actually particularly give you some kind of definitions to think about. So what's the social isolation and the loneliness? So social isolation is defined as the objective state of having few social interaction relationships or infrequent social contact with others, while loneliness is a subjective feeling of being isolated. So even before COVID-19, social isolation and loneliness was seriously yet underestimated public health risk that affect a significant portion of the older adult populations. So right before the outbreak of COVID-19, the National Academy of Medicine issued a white paper that particularly focused on addressing social isolation and the loneliness in older adults in the United States. So these are the figures prior to the outbreak. So basically, based on estimate, in the United States, approximately 1/4 of community dwelling older adults are considered to be socially isolated, and 43% of them report feeling lonely. So these are older adults. These are all older adults kind of estimate from this national report. So that the COVID-19 pandemic has undoubtedly exacerbated this issue. That prior to the disease outbreak, the vast majority of community dwelling older adults actively participated in social activities, such as attend the senior centers, church activities, traveling, and many other social events. Community-based long-term care also plays an important role for many frail older adults. So these community services and the programs cover adult daycare, respite care, homemakers, Meals on Wheels, and home health services. For frail older adults living alone, meal delivery of staff may be the only person they meet on a daily basis. New York Times several years ago that published an article, particularly kind of called this kind of Meals on Wheels services as a kind of as a daily friendly visit to older adults. So for nursing home residents, family visits are important for older residents because these visits make them socially connected. And the family members are the link to the outside world. However, due to lockdown, all these services and programs were no longer available. So these restrictions will certainly increase social isolation and the feeling of loneliness for older adults. Then here is a recent survey that conducted looking at the changes in loneliness in the social context prior to the COVID, and actually compared to after COVID among adults age 50 to age 80. So prior to the COVID, 34% of these adults felt a lack of companionships, while actually during COVID, 41%, the percentage increased, 41% reported the impact of felt a lack of companionship. Then prior to COVID, 27% felt isolated from others, while this percentage doubled. 56% that during COVID reported felt isolated from others. Then prior to COVID, 28% had infrequent social contacts. Then actually during COVID, 46% reported having infrequent social contacts. So here is some actually the table from a report published at JAMA last month, looking at the social connection, decreased the social connectedness since the start of COVID-19 pandemic among actually Medicare beneficiaries. So if you look at it, that this is the right kind of column here, percent of beneficiaries within specific categories who reported feeling less socially connected. It's interesting when you look at this, that the age group, these are all older adults, of course. Then you look at the older adults, 65 to 74%, or sorry, have some actually Medicare beneficiary that younger than 65, but have certain certain characteristics. Here that for older adults, that 65 to 74 age group, that close to 40% that reported that feeling less socially connected, higher actually than more older adults, 74 years and older. Then women actually have a higher percentage that reported feeling less socially connected. It's 41% reported versus 31% in men. Then also that for white non-Hispanics, that this is have the highest percent reported compared to other racial ethnic groups. 39% reported less socially connected, while other population Black actually the 25% reported less feeling less socially connected. So these are actually on computers, on smartphones, access to internet. These are all reported the high percentage that have less socially connected. So when you look at the kind of overall that while controlling for other characteristics, the foreign individuals were more likely to report a negative association of the pandemic with perception of social connectedness. Overall, women are more likely to kind of report less socially connected. High-income individuals reported less socially connected. The non-Black and non-Hispanics reported as well, and had a history of cancer or depression that are more likely to report socially less connected. So overall, more than 1/3 of Medicare beneficiaries reported feeling less socially connected to friends and the family since the start of the COVID-19 pandemic. That impact of social isolation, certainly that the increasing evidence demonstrate that social isolation has detrimental impact on individuals' health and well-being. Studies, including our own, have found that social isolation is a major risk factor that has been linked with poor physical and mental health status, increased blood pressure, heart disease, obesity, diminished immune system functioning, depression, anxiety, poor cognitive function, increased risk of Alzheimer's disease and mortality. Social isolation has been associated with an approximately 50% increased risk of developing dementia, a 29% increased risk of incident coronary artery disease, and a 32% increased risk of stroke. So that in the next few slides that I'm going to present some of potential strategies that to decrease social isolation and loneliness. So that certainly that we all know that use of technology is critical in addressing social isolation. So here that this is the image that win the competition of the 2021 NYU Aging Incubator Image competition. So I'm going to I'm going to read a part of her writing that she submitted along with this image. So here it said, this image I drew, actually that the student drew this image. This image I drew evokes happiness and sadness. It depicts a grandmother who has learned how to use technology to video call her family members. In these harsh times of COVID-19, older adults had to learn to cope with the use of technology to battle social isolation. My grandmother, who never had any interest in learning technology, is now learning at her own pace. I'm not sure who gets more excited, my grandmother or me. When I see her calling on my phone, I especially love how close older adults get to their phone when they video call someone. I think it's precious and try to show that in the image I drew. So that's a very interesting image that showed how important the technology and the role of technology that play in daily life for older adults. So here, actually, I want to kind of share this the articles that published from New York Times that think about what elements of communication do we really need to feel meaningfully connected to people. So here is that a group of researchers did an experiment. So these students were asked to perform math and the verbal task in front of an audience, and then given randomly assignment form of parental contact, like either in person, by text, by telephone, or actually no contact at all. So that the researchers asked the children afterwards how they felt, and then measured their levels of stress hormone cortisol. So here's the results, that texting with a parent provided no more comfort than having no contact at all. Telephone communication was just as effective as being able to touch and see a parent. So that's what that reminded me of thinking about this Helen Keller's that beautifully put in this way, say, blindness cuts us off from things, but deafness cuts us off from people. So the clear implication that from this experiment is that you don't need to literally see your loved ones and friends to feel you bond with them. So that's what this the kind of quote that reflects here. So interestingly, that actually this ad was reported from the Washington Post. So I actually find this is a very fascinating kind of image. This is a telephone company's ads during the 1918 Spanish flu pandemic, which is more than 100 years ago, on this kind of telephone advertisement. it shows the importance of having social connections via telephone. So the message actually, it is also fascinating. It's that when you're in quarantine, people who are in quarantine are not isolated if they have a Bell telephone. The Bell service brings cheer and encouragement to the sick and is of value in countless other ways. Friends, whether close at hand or far away, can be easily reached because Bell service is universal service. So it's just think about 100 years ago that people start kind of thinking about how to use telephone to connect friends and family members during this during that the last century's pandemic. So so it is important to think about the role of technology in addressing social isolation. It is important to develop innovative technology-based intervention to improve social connection for this population. Mobile technology can be instrumental as they are transforming the way in which we interact with each other. That find information, access resources, and deliver services. So it is time to develop more person-centered applications with the input from older adults and their family members. Existing evidence-based interventions for older adults can be useful as the basis for creating needed social support via videos. In addition, peer support via social media may enhance the effects of evidence-based professional support, such as information, resources, health promotion, and the counseling and problem solving. On the other hand, we also need to be aware that as with other areas of healthcare, ethical and legal consideration must be explored when the technology is used in interventions for isolation and loneliness. That the digital divide, that this is become a prominent issue facing during the COVID-19. That telehealth, that we all think about telehealth during the pandemic. Telehealth is booming, but this could leave many people behind. The lack of reliable access to internet, email, and smartphones for many low-income older adults. So based on UK's Office of National Statistics, that the report found that in 2020 that around 92% of the UK population as a whole use the internet, compared to only 54% of people aged 75 years or older. So certainly that has this is a kind of digital divide that between the age groups, that for older adults is way less than actually compared to the general population. So that also some practices that show that care for predominantly middle to upper middle class patients are already performing well over 50% of their telehealth by video, while that the low-income patients are receiving their medical care by telephone. That was actually much lower. That figure 23%. Sorry, the figure actually dropped from the slide, 23%. So that is so. October 1st was the International UN International Day of Older Persons. So this year, the 2021 theme for this International Day of Older Person is digital equality for all ages. So basically that globally, that 1/2 of the global population is offline, with the Scottish, the dramatic contrast between the two most developed countries, that which is 87% that the population are online. However, that for the least developed countries, only 19%. that had access to internet. So recent reports by the International Telecommunications Union indicate that women and older persons experience digital inequality to a great extent than other groups in society. Just imagine in these least developed countries that older adults' access to internet even would be less than 19%. So older adults either lack access to technology or often not benefiting fully from the opportunities that provided by technology progress. So we need to address the issue of how we can promote digital equity for all ages, that particularly for older adults who are left behind. This is a challenge for us. So I published a paper last year looking at that, particularly for the focus of social isolation, the loneliness among older adults in the context of COVID. This is a global challenge that I stated that here is that the healthcare system is well positioned to develop methods to identify social isolation and loneliness in healthcare setting, by identifying those at highest risk and whether their condition is acute or chronic. Healthcare providers may be able to use these findings to develop appropriate clinical and public health interventions for patients. Health professionals, schools, and direct care worker training programs should include education and training materials addressing social isolation and loneliness in their teaching curriculum. So, and also that development of more telehealth approaches can provide older adults and their families with better access to healthcare providers and facilitate screening, diagnosis, and the treatment of social isolation. So that this is, here's the kind of report, AARP special report on COVID and the nursing home, which was published January this year. The report, so basically the reporters interviewed 3 dozen experts and policymakers and came up 10 steps to reform nursing homes, because this is the path forward. So here is that one, I was very glad that actually among these 10 kind of recommendations, they took my suggestion as one of this, is that, quote unquote, I said, any plan for improving nursing home quality of care has to address isolation. That we need to include measures of social isolation and loneliness as a part of standard quality indicators. So as Arthur Clement from Harvard wrote in his book that titled The Soul of Care, he stated that nursing homes and hospitals don't measure care directly. We don't have a direct measure of care. What we measure institutional efficiency as a substitute for care, as they measure the support for the patient. So what are they measuring? The support for patient and the residents? Yes, basically, it's all in terms of institutional efficiency. So what he suggests that we should directly measure care from social and ecological perspective. We have to measure communications between residents and their staff, the quality of the relationship between residents and staff and the healthcare providers. We have to measure the time spent by nurses and the doctors actually taking care of people, as opposed to looking at computers. So these are the kind of things that we also need to look at, some qualitative measures to measure the care that provided in these kind of institutions. So that my colleagues and I actually published a paper recently that look at 6 countries lessons, say what COVID-19 innovations can teach us about improving quality of life. So here's that basically 4 parts of innovations to improve quality of care in nursing homes during or after COVID. Look at increased resident social connections, promote communications between families and the care staff or administrators, improve physical fitness, support relationships between residents and the staff. So these are the kind of detailed the innovations, 18 innovations coming out of these 6 countries that based on our literature review. So these are kind of interesting way to think about how we can improve health and well-being and the quality of care in nursing homes. So I'm just going to stop there and welcome your questions for this presentation. Thank you.
Thank you, Dr. Wu. That was actually a very informative presentation. And we do have a question. Somebody would love to get a copy of your slides if they are available.
Mm-hmm. Yeah.
Excellent. So for the person who is asking about that, if you just email nursing.alumni@nyu.edu, I will make sure that you get a copy of the slides from Dr. Wu's presentation.
Yeah.
Great. Yeah. If you have any more questions, just definitely put them in the chat.
I stop sharing.
Sure, you can stop sharing. That'd be great. One question that I wanted to pose to you was about the digital equity that you were speaking about. Mm-hmm. Are there any, again, this is kind of a new area that we're in this space. I don't even want to say we're post-COVID, but we're still in COVID. It's just not as acute anymore. But are there things that we've learned from this that are moving, in particular, our older adult community into a more digital equity space?
Yeah, that certainly that think about telehealth will stay. That certainly that more and more kind of initiatives we're pushing for telehealth. That certainly to some extent in a positive way that can certainly reach out to more individuals who have lack of traditionally have been lack of access to healthcare. So just several ways to think about how we can actually tackle this digital divide, the issue of digital divide. The one is certainly from older adults in the family perspective, that we can certainly provide more training and workshops to increase their kind of technology literacy, to think about how actually to use technology. As that I shared this image from this image competition that older adults during this COVID actually now are learning more how to use technology. So that this is certainly, we'll see that more and more older adults are able to use technology that after COVID, or even right after the outbreak of COVID. So, but also actually from the supply side, think about healthcare providers, tech industry, that I mentioned briefly, that how we can actually design these kind of apps, design these apps that are more friendly towards older adults. That we need to, during the actually even the start of the kind of designing phase of the app, that we can involve older adults, their family members, to provide input, to think about how we can design that these apps that can be more friendly to older adults. that particular older adults with sensory kind of impairment and some kind of functional impairment. So these are the things that we need to think about. And also from system level, that how we can actually kind of improve our access, that, for example, the internet access, technology access. So certainly during COVID last year, I understand New York City, actually city government has distributed the free tablets to older adults, which is, I applaud this kind of initiatives to think about how actually you gave the free technology, that these kind of smartphones or tablets to older adults, that facilitate them to use technology. So this is also something that we need to think about. And access to internet, that surprisingly speaking, that think about even in New York City, some spots that in the New York City that internet may not be stable, that have that is a kind of issue. There's no excuse for that. When you travel, I remember that when Tom Friedman, the New York Times columnist, actually wrote a book that the world is flat. That book is more than 15 years ago, when he traveled in Japan, that in this high-speed train that he was traveling, the internet was so good. There's very good quality of internet. But now we're talking about even in the city that we cannot get a stable internet. There's no excuse for this. Okay, so that we, so you're talking about the richest country, that we're talking about infrastructure. What kind of infrastructure we have to actually put us in a global competitiveness in that sense? So these are the things that we need to think about at a multi-layers kind of approaches to address this digital divide, the issue of digital divide in this country.
Yeah. Sounds like there's a lot that can be done, for sure.
Mm-hmm. Yeah.
So we have another question. Can you please tell us if there are tools to measure loneliness, and how can providers assess loneliness among those with cognitive impairment?
Yes, that these kind of just think about some questions that you can ask. Very simple, straightforward. Particularly, actually, the sense of loneliness kind of questions is like whether you are lonely or not, how frequently you contact your families. So these kind of questions, like what also Clement was saying, that even some qualitative measures to think about communication, to think about their kind of relationship with their family members, their relationship with healthcare providers. These actually can a way to think about the care that older adults receive. So in terms of loneliness, we have done some studies and some ongoing kind of data analysis, look at even national data, have some question about how lonely you are, that giving these kind of skills that for people to kind of fill out. So that's not that difficult, that self-reported measures, or even for persons with cognitive impairment, that unless they're really into kind of severe stages of cognitive impairment, many of them still are able to report these kind of measures.
Yeah. Thank you. So I always like to consider where we are academically as well. So if you've done so much research on this particular topic and about older adults in general, what would you, if you could put anything into the curriculum for our nursing students now, what would you add to their education to help prevent loneliness in our older adult communities?
Yeah, so for example, that as I said in my talk, think about many of our nursing students, when they graduate, they will be in healthcare system that in healthcare settings, this is one of the areas that is actually that older adults compared to other age groups, they probably use healthcare system the most as a consumer. So these kind of healthcare settings that we as a healthcare providers, and particularly nurses, to think about how we can learn to identify these issues, to make a kind of diagnosis, and also think about how to kind of provide some ways to address this issue. So that's something kind of as a part of the curriculum that we can teach individuals. For example, similar like kind of the issue of elder abuse, issue of kind of depressive symptoms, these kind of mental health the issues, that how we can actually train our healthcare providers, that our students to recognize and identify these kind of issues that we then encounter in older adults.
And we've gotten a kind of a follow-up question to that. This person is not actually a nursing student, but they are wondering what kind of knowledge or professional path and academic curriculum would contribute to the study of loneliness and human connection.
What kind of curriculum?
Right. What kind of knowledge or professional path and academic curriculum would contribute to the study of loneliness and human connection?
Yeah, I think this is certainly that as a part of a kind of mental health the curriculum, that it should be a part of that. That also, yeah, that's what I think that we need to be as a part of this, as a mental health curriculum.
Great. Any other questions? Let's see. Is there anything that, you know, thinking from a clinician standpoint, you mentioned quite a few things that people, that our nurses can do to really prevent some of this loneliness and isolation that our older adults are feeling. But is there anything maybe from like an advocacy standpoint that they could do like in their institution to help bring some of those things into their practice and even into their institution?
Well, that's what, when we think about that, the nursing homes or healthcare settings, we talk a lot about reimagine nursing homes or reimagine long-term care delivery system. That think about this, we have a lot of nursing homes, the quality of care has been an issue. It's a long-standing issue in terms of long-term care, that the system, that how to develop a quality of care. So one thing that I think we need to think about in terms of measurement, in terms of quality indicators, what kind of quality indicators that we're talking about? How we actually measure the quality of care? What are we measuring? We're measuring, for example, that what I said earlier, is it institutional efficiency, or we're truly measuring care quality? So that's what that we need to think about, developing more person-centered measures to measure quality of care. Then also think about linking these kind of quality of care measures to the reimbursement, to financial kind of incentives for improving care for example, long-term care residents. So that's what we need to think about. Right now, these kind of measures, I really think that we need to rethink many of the measures that we are actually using in long-term care settings. So that's a part of actually what I'm trying to say is that you need to actually really think about more self-reported measures, not only actually from the resident perspective, and then potentially bring in family caregivers perspective. So just think about measuring, think about the how we actually truly tap into the true the kind of the care measures that we have. Then think about the financial system perspective.
Mm-hmm. Yeah, we received kind of a similar question to that one. I think you've answered most of it, but I'm going to pose the question anyways, and you can just make any follow-up comments that you would like. But again, I think you had just addressed a lot of this, but the question is, how can we specifically assess and address social isolation in nursing homes? And it would be enough to focus on culture change and person-centered care.
Yes, actually, that person-centered care, my colleagues and I actually have developed some actually that we develop some particular kind of measures to think about what are the kind of domains that we need to capture in long-term care settings. We actually have been working with a group of international researchers to develop a person-centered care measures, to think about also identify common data elements, the cross countries, what matters the most, that what matters most for patients, for residents, that these kind of measures, that certainly these the social isolation, the loneliness is a part of the measures that we think it's important to be included.
Got it. The next question is, what are the protective behaviors that have been shown to prevent loneliness?
Yeah, think about, right, so some of the behaviors when you think about the physical activity, let me actually look in, I have this, oops, where is my, here, right. To think about that in my last slides that I have is, for example, that outdoor fitness, that virtual strength fitness classes with family, staff, and the members, virtual the strength fitness classes with family members. That these physical activities certainly is good for our not only physical health and also for our brain health. There's many evidence to suggest that the supportive relationships is also really important. That is also related to topic that I have been talking about in terms of decreasing social isolation. That good quality relationships with loved ones, that have a contact, socially engaged with community organizations, that has been kind of showing that very much kind of as protective factors. Think about these connections that socially connected, and also communication, good communications between family and the staff. These are the things that certainly will be beneficial. Certainly eat well, sleep well. These are traditional wisdom that certainly apply to many of these health indicators, health outcomes.
Thanks. Any other questions? We've had some great questions tonight. I appreciate everybody participating.
Yep.
Anything else? If that is all, we're actually almost to the end of the evening. So I just want to thank you, Dr. Wu, so much for being a part of this evening. It was a wonderfully informative lecture tonight on your research. So hopefully we can have you back again sometime to share your new research. So I know you've got a lot of different projects going on, so we'd love to hear about some of the other things that you do as well. And to all of our guests tonight, thank you so much for being here. We appreciate you being a part of the NYU Myers alumni community, and we hope that we see you at the next event. We are having Alumni Weekend coming up on October 23rd, so I encourage you to come that weekend. It's all virtual. We'll be having our award ceremony as well as another faculty panel. So we look forward to hopefully seeing you then. So, all right. Good night, everybody.
Thank you. Okay, bye-bye.
Bye-bye.